Hi, I'm Mary McQuilkin, adjunct faculty for the University of Alaska Fairbanks Center for One Health Research. In this video, I'll provide a brief history of One Health, including some scientific milestones that helped shape this developing field. The conceptual underpinnings of One Health have a long history. The interconnectedness of humans, animals, and the environment is embedded in indigenous knowledge dating back thousands of years. That interconnectedness of humans, animals, and the environment, and the lack of a barrier between these domains, is foundational to both traditional ecological knowledge and One Health. Traditional ecological knowledge recognizes the reciprocal relationships and stewardship that exists between humans and the natural world, in which humanity and nature are connected and bidirectionally dependent. The quotes below are from qualitative research interviews conducted to explore aspects of Indigenous knowledge systems related to One Health. They reflect the principles of environmental stewardship and a mutualistic relationship between humans and wildlife, which is embedded in origin stories, ceremonial practices, and elders' teachings of many Indigenous societies around the world. It only became known as One Health over the last couple decades, and it's still an evolving concept. One Health, as we know it today, was developed in the veterinary medical profession, where it focused on monitoring for and controlling zoonotic diseases. Smallpox was a viral disease that caused fever, headache, vomiting, a pustular rash that caused permanent scarring, and left some blind. The case fatality rate was 70% among pregnant women and 30 to 50% for others. One of the first methods of controlling smallpox was variolation, a process named after the virus that causes smallpox, variola. During variolation, people who had never had smallpox were exposed to the material from smallpox pustules by scratching it into their arm. People would get a mild case of smallpox, but fewer people died from variolation than if they had acquired smallpox naturally. In 1768, country doctor John Fuster made the clinical observation that a group of farmers who had recovered from cowpox were all immune to smallpox when he tried to inoculate them via variolation. According to medical historian Dr. Arthur Boylston, the famous milkmaid story was likely fabricated after Jenner's death by his biographer. Based on letters, diaries, and medical notes from the time, as a 13-year-old orphan, Jenner was apprenticed to two doctors who heard about Dr. Fuster's clinical observations at a meeting of doctors and likely passed along the story to Jenner when they got home. In 1796, Jenner tested the theory that exposure to the relatively mild disease of cowpox would protect people from the far deadlier disease of smallpox. He vaccinated James Phipps, the 8-year-old son of his gardener, with pus taken from a cowpox pustule from the milkmaid Sarah Nelms. And it worked. The boy proved immune when exposed to smallpox after vaccination with cowpox, as did several other children Jenner experimented on, including his own 11-month-old son. Jenner's work went down in history as the first scientific attempt to control an infectious disease through vaccination. German pathologist Rudolf Virchow is credited with being the first Western scientist to understand that a sick animal can spread the same disease to humans. He coined the term zoonosis while studying Trichinella spiralis in pigs in 1855. He described the life cycle of Trichinella and its zoonotic consequences. He also pioneered the use of microscopes to study disease and observed that in disease states, the entire organism doesn't get sick, only certain cells or groups of cells. He was the first to recognize leukemia. His work in cellular pathology laid the foundation for the field of comparative pathology, which is the study of disease by comparing two species such as humans and other animals. Virchow helped start to shift the medical field from a worldview shaped by superstition to one based on objective observations and science. At the time, Greek and Roman superstitions about the cause of disease still predominated. For example, miasma was the theory that cholera, chlamydia, plague, and even non-communicable diseases like obesity were caused by bad air, which was described as a toxic cloud of vapor or fog that lingered in certain areas and sickened those who passed through it. Virchow helped start to shift medicine from a worldview shaped by superstition to one based on objective observations and science. The theory of spontaneous generation, the notion that life can arise from non-living matter, dates back to Aristotle and the ancient Greeks. An experiment by Francesco Redi provided the first significant evidence refuting spontaneous generation. He showed that flies have to be allowed to land on meat for it to then produce maggots. If the meat is protected from flies, no maggots will appear. French chemist and microbiologist Louis Pasteur boiled broth in swan neck flasks to sterilize it, then demonstrated that the intact flask, which allowed air to escape the long neck but didn't allow microorganisms from the air to enter, remained sterile. But if the neck is broken off, allowing microbes to reach the broth, they grow. This showed that microbes are in the air and don't spontaneously generate from sterile broth. Pasteur's experiments irrefutably disproved the theory of spontaneous generation and perhaps put miasmas to rest once and for all. While researching chicken cholera, Pasteur asked his lab assistant to inoculate the chickens with fresh bacteria culture before leaving for vacation. He forgot and also went on vacation. When they got back, they tried using the months-old culture on the chickens. The chickens showed some signs of infection, but instead of all dying like normal, they survived. This showed that the culture was attenuated, made less virulent, and when injected a second time with this aged bacterial culture, the chickens didn't show any signs of infection at all. They were totally fine, showing that the weakened bacteria helped the chickens become immune to the infection. Recognizing that a pathogen's virulence could be increased or decreased was an important advancement in our understanding of infectious diseases and helped pave the way for future vaccine development. While bacteria had been discovered previously, German physician and microbiologist Robert Koch was the first to design an experiment to show that a specific bacteria was the cause of a disease. The postulates for disease causation were originally formulated by the German pathologist Friedrich Henle, which Koch built upon. The Henle-Koch postulates are: the microorganism must be found in diseased but not healthy individuals. The microorganism can be isolated from the diseased individual and grown in pure culture in the laboratory. The cultured microorganism will cause disease when transferred to a healthy, susceptible individual, and the same microorganism can then be re-isolated from the newly infected individual. He discovered the causative agents of cholera, anthrax, and tuberculosis, and he also worked with malaria. He was the first to use an oil immersion lens, condenser, the first to successfully photograph what he was seeing under the microscope, and he developed staining techniques still in use today. Koch initially tried growing bacteria on slices of potatoes, which didn't work so well, but then he started growing bacteria on agar, and his apprentice, Petri, formalized the Petri dish as we know it today. Robert Koch demonstrated the importance of considering animal health during human public health work through his research on bovine TB. He proved that the same bacteria that cause tuberculosis in cows can be transmitted to humans and cause tuberculosis. He also helped lay the foundation for One Health by emphasizing the importance of a multidisciplinary approach to prevent the spread of zoonotic diseases. About 40% of cows exposed to bovine pleuropneumonia contracted the disease, and the case fatality rate was about 50%. In the 1880s, bovine pleuropneumonia was causing significant morbidity and mortality among U.S. cattle, so Congress created the Bureau of Animal Industry in the Department of Agriculture to control it and other animal diseases. As the leader of this new program, Dr. Salmon successfully eradicated bovine pleuropneumonia in just over 8 years. He strengthened evidence for the germ theory by proving that microorganisms were the cause of fowl cholera. He and his colleague Theobald Smith also proved that ticks were able to transmit Texas cattle fever. In 1928, physician and microbiologist Alexander Fleming got back from vacation to find that mold had grown on his agar plates of Staphylococcus aureus. He saw a clearing at the edge of the mold where no staph was able to grow. A researcher in the same building below Fleming's lab was working with mold at the time, which traveled through the air up to Fleming's lab and got on his agar before the Staphylococcus aureus could grow. Soon after discovering penicillin, Fleming realized that antibiotic resistance could develop if too little penicillin was used or if it wasn't used for long enough. He cautioned the public and medical community not to use penicillin unless there was a properly diagnosed condition, and that it should only be used in sufficient quantities for sufficient duration to treat the infection. Otherwise, bacterial resistance to the antibiotic would develop. It took years for Fleming to convince others of the clinical importance of his discovery of penicillin, but during the mid-1940s, the United States and British governments helped support the team at Oxford to develop methods for large-scale production and distribution of his life-saving antibiotic. The World Health Organization estimates that antibiotics add an average of 20 years to the human life expectancy. Unfortunately, we did not heed Fleming's warning. In 2015, about 80% of all antibiotics sold in the US were used in food-producing animals. About 70% of those were medically important antibiotics. If you're comforted by the lower percentage of medically important antibiotics used in animals, you shouldn't be. I'll get into that in another lecture. So why are massive amounts of antibiotics being used in pigs, cows, and chickens? The agricultural industry started using them to promote growth and to prevent rather than treat infections. This practice of adding antibiotics to animal feed given to entire herds, not for the purpose of treating an infection, is known as non-therapeutic use. About 75% of antibiotics an animal consumes are excreted from the body in their feces and urine, which contaminates the surrounding environment, including water and manure that's later going to be used as fertilizer for food crops. The misuse of antibiotics in food-producing animals has led to diverse antibiotic-resistant bacteria and antibiotic resistance genes, which can be transferred in animals and humans. There's increasing evidence that antibiotic resistance in humans is mainly related to the wide application of non-therapeutic antibiotics in animals. While there have been improvements in antimicrobial stewardship by clinicians prescribing antibiotics to human patients in the years since, and there were laws passed in 2016 to restrict the use of antibiotics in animal feed to promote growth and prevent infections, rather than to treat infections, there are signs of backsliding in agricultural misuse of antibiotics, especially globally. American veterinarian James Harlan Steele is recognized as the father of veterinary public health. He was inspired by the 1918 influenza pandemic to study infectious disease, then pursued an internship at the Michigan Health Department to study zoonoses specifically after several of his classmates got brucellosis. After Steele created the first veterinary public health program, the U.S. Surgeon General created a veterinary medical officer role in the United States Public Health Service per Steele's request, a category which still exists today. Steele represented the CDC at the World Health Organization Expert Committee on Zoonoses meeting in 1950. Then he chaired the second meeting in 1965. The meetings brought together global scholars of zoonotic diseases and emphasized the need for international collaboration to pursue common goals. James Harlan Steele dedicated his career to advancing understanding of the connections between human health and animal health. A colleague of James Harlan Steele, Calvin Schwabe, is known as the father of veterinary epidemiology. He revitalized the concept of one medicine and called for the fields of human medicine and veterinary medicine to work together to combat zoonotic diseases. His work focused on the practical application of this integrated approach. In 1966, Schwabe became the founding chair of the Department of Epidemiology and Preventive Medicine at UC Davis Vet School. It was the first department of its kind at any veterinary school. D.A. Henderson earned his MPH at Johns Hopkins in 1960. He returned as a professor of epidemiology and international health and the dean in 1977. That's me getting him to autograph his book, Smallpox, The Death of a Disease, when he came to lecture to my MPH class in 2012. D.A. Henderson led the World Health Organization's Global Smallpox Eradication Program, which started originally in 1959 with an intensified program starting in 1967. D.A. Henderson was also instrumental in initiating the World Health Organization's polio eradication program. Polio has been very nearly eradicated, but is still endemic in Pakistan and Afghanistan, with some cases occurring every year. The ability of laboratories to produce higher quality freeze-dried vaccine, the invention of the bifurcated needle, which was designed to hold a dose of reconstituted smallpox vaccine in its prongs and puncture the skin to the ideal depth, establishment of a smallpox case surveillance system, and mass vaccination campaigns all contributed to the successful eradication effort. The last naturally acquired smallpox case was in Somalia, and one person died after that in 1978, but she was infected by a microbiology lab conducting research on smallpox. She was working one floor above the lab and was exposed to airborne virus, which also spread to her mother, who cared for her, but survived. The World Health Organization declared smallpox eradicated on May 8, 1980, almost 2 centuries after Jenner developed the smallpox vaccine. Under D.A. Henderson's leadership, smallpox became the first disease in human history to be completely eliminated worldwide. One Health gained international attention in the early 2000s following outbreaks of H5N1 highly pathogenic avian influenza A, severe acute respiratory syndrome or SARS, and Ebola. Those responses highlighted the need for collaboration across disciplines and shed light on the serious environmental issues that increasingly put the health of humans, animals, and entire ecosystems at risk. In 2004, the Manhattan Principles were produced at a Wildlife Conservation Society symposium hosted by the Rockefeller University. They introduced a set of priorities for an international and interdisciplinary approach to combat joint threats to human and animal health. I'm not going to read all 12, but to give you an idea, here's what the Manhattan Principles urge of world leaders, civil society, the global health community, and institutions of science. If you'd like more time to read them all, you can pause the video, but I'll also include the link below. Rinderpest, also known as cattle plague, was a viral infection closely related to measles. Rinderpest was around for a very long time. It's thought to have played a role in the downfall of the Roman Empire and was described even before then. Outbreaks caused the deaths of millions of cattle, buffalo, yak, and wild animals, often leading to food shortages, starvation, and social unrest. Vaccination of cattle against Rinderpest was initially started in the 60s, and in 1994, the global Rinderpest eradication program began. In addition to vaccination, the eradication program included globally coordinated testing, laboratory training and development, monitoring and clinical surveillance, and reporting systems. By 2009, 170 countries had eliminated Rinderpest. The final outbreak occurred in Kenya in 2001. Rinderpest became the first animal disease to officially be eradicated worldwide in 2011. It's the second disease to have been eradicated globally after smallpox. The impacts of the COVID-19 pandemic on populations around the world were profound. This graph shows there were 7 million confirmed deaths due to COVID-19, but it's important to note that for a case to be confirmed, a medical test must be performed, then that test result must be reported by a health department or government. The entire continent of Africa had very few confirmed deaths from COVID-19, but that isn't because populations there were less vulnerable to the virus than the rest of the world. Many people in developing countries didn't have access to medical testing, and their governments lacked the capacity to gather counts of cases and deaths and report the data. Estimated cumulative excess deaths is a measure that helps address the lack of data from countries that didn't have adequate access to testing and public health surveillance. Here you see more than 25 million people around the world likely died during the COVID-19 pandemic, whose deaths were above the level that would have been expected for that population. The COVID-19 pandemic shed light on the serious threat zoonotic diseases pose in today's interconnected world. It also revealed the absence of a comprehensive One Health surveillance system that could have enabled earlier, more coordinated responses. While multinational data sharing systems would be ideal for preventing future pandemics, political and social barriers, magnified by today's media environment, remain a major hurdle to developing a fully transparent, efficient, global surveillance system. Even the origin of the SARS-CoV-2 virus in Wuhan, China, created tremendous social and political controversy. In my opinion, regardless of how that first spillover event actually went down, taking direct, practical steps to mitigate the risks posed by both wet markets and labs would be a logical One Health approach. Both are dangerous, so we should make both safer. The wet markets trafficking live wild animals and overcrowded, unsanitary conditions are a huge risk for zoonotic disease transmission. Measures to prevent these markets from continuing to operate as they do could include reducing consumer demand for these animals through social change, enforcing sanitation and animal welfare regulations, disincentivizing poaching of wild animals, and applying international pressure to ensure compliance. We should also ensure international research laboratory standards are established and enforced to mitigate the risk of a pathogen originating from a lab in the future. Unfortunately, much of the public discourse was dominated by conspiracy theories and focusing on who to blame, which diverted attention from practical measures that could meaningfully reduce the risk of future pandemics. The One Health high-level expert panel, an advisory group comprised of international experts appointed by the quadripartite organizations, formed in 2021 to formalize the One Health framework. In 2022, they published their definition of One Health and launched the One Health Joint Plan of Action, which builds on existing One Health initiatives aimed at strengthening capacity to address complex multidimensional health risks with more resilient health systems. To show how interest in One Health has changed over time, I searched Google Trends to see searches for the term One Health. Numbers on the y-axis represent search interest relative to the highest point on the chart. A value of 100 is the peak popularity for the term, and a value of 50 means that the term is half as popular. The day the highest number of searches were conducted, Google Trends makes that number of searches 100 and scales everything else in comparison to that. You can see a dramatic increase in the number of searches for One Health during the COVID-19 pandemic. Google searches are useful for gauging what the general public is interested in, but not necessarily what the scientific community is interested in. As a measure of scholarly interest in One Health, here are results from PubMed, which is the most popular database for medical journal articles. Again, you see a rapid increase in academic literature related to One Health over the last couple decades, with the sharpest increase during the COVID-19 pandemic. Interest in One Health in the academic literature started to pick up in the early 90s, but the most significant increase was over the past 10 years. One Health is still an evolving concept, but progress has recently accelerated in Western science's recognition that population health issues in humans and animals are not compartmentalized, and that a multidisciplinary approach with human medicine, veterinary medicine, environmental science, government, and communities all working together is needed. I'd like to acknowledge that most of this brief, cherry-picked history of One Health I put together isn't exactly about One Health, because it didn't exist at the time, and the societal context and environmental settings in past eras mentioned here were radically different from our present reality. I hope this video sheds light on how One Health was shaped by the past and inspires ambition to meet the challenges of the present.